The whole point of
Yay.
this is to have people on, highlight real,
Right,
actual work people are doing in the community,
right,
less so just politicians, you
right,
know.
right.
But
Yeah,
before we get into
I watched your interview this with the person who I forget her name. I just know
with
she's
Judy,
replacing Vitali.
yeah,
But yeah, that sounded great. It sounded good. Yeah, and you covered a lot of territory.
I tried. Before we jump into like your specific activism on Medicare for All, I
Right.
want you to tell me a little bit about your time at Swarthmore in the early 2000s. I know you spoke about it on the National Single Payer webinar, but
Right.
if you could just describe it again, that would be great.
Sure. Well, first of all, after teaching for 10 years at Nether Providence High School, I joined the education department at Swarthmore College. And working at the college, I received a firsthand education of the inner workings of academia. And the campus was beautiful. My department was consistently supportive. And as a staff member, I had the opportunity to take outstanding courses. And embracing Quaker values was touted as the cornerstone of the college's philosophy. But what struck me almost immediately that was in talking with other employees about their jobs and experiences at the college, that these discussions all of a sudden were held in whispers. It was like
That's
it was it
that's
was like
odd.
it was like an indication that folks didn't feel free to critique the system or, say anything. It was just interesting.
And at a Quaker institution, that's interesting.
Yes, yes, and it was just like, you find a place to talk somewhere, couldn't let anybody hear what you were saying. Anyway, that was just something that struck me almost right
It's like
away.
you're whispering under the stairs at high school again, right?
Exactly, exactly. So, anyway, the starting wage when we began our campaign in the early 90s was $5.50. And the students were exceptional in their advocacy, performing extensive research, hosting guest speakers, organizing petitions, holding meetings with staff and faculty. They just followed the playbook perfectly. And despite having a $1 billion endowment, the college resisted raising the wage for 4 years. Ultimately, they agreed to a wage of $10.38 after the faculty joined the push for support.
Why 38 cents exactly?
That's what they came up with.
Interesting.
That was the number they arrived at. The research we conducted on living wage brought us into discussions with dining hall staff, environmental service staff, and what we learned that even though the college offered a healthcare plan for all employees, some workers still could not afford their medications. And we realized that healthcare and a living wage are inseparable. They go together.
And what made you decide specifically to focus your activism on Medicare for All?
Well, from my experiences at Swarthmore College Living Wage and Democracy campaign, hearing these heartbreaking stories of staff made it clear that Medicare for All was the only solution to assure that everyone would receive health care coverage they needed.
So you've also done a lot of work to engage with Mary Gay Scanlon. In 2019, I believe you mentioned that you brought physicians, union reps, community members, all to meet Mary Gay Scanlon.
Yes,
What did that look like? Can you walk me through that? What did you ask? What did she say? How did it
right.
all play out?
Well, our presenters offered compelling testimony in favor of Medicare for All. The details on policy, personal stories, including stories that people had about their cancer diagnosis, quotes from scripture, and overall heartfelt testimony was truly amazing. And I wrote the team afterwards that, quote, only the coldest of hearts could not be moved by what they said. Scanlon's major objection was the effect of Medicare for All on employees in the private healthcare system and the fact that they would all be out of work. But what we've learned since that time is that we could give all 1.5 million healthcare industry workers 2 years severance pay after we pass Medicare for All, and it would still be cheaper than what we have now.
And despite the coalition you had and the preparation, she declined to co-sponsor. What were your initial thoughts then when that happened?
Well, I think it just sort of took the wind out of our
Like a gut punch.
energies because we just thought that our evidence was so compelling. How could she not, support this? So that's when I decided in 2025 that we needed a whole new strategy, that we couldn't do what we did before. That did not work. And I started the initiative myself because I wasn't sure that collecting signatures would be an effective strategy. I didn't know that was the right way to go. So it was kind of
And
an
what
experiment.
month did you start collecting signatures?
I
It was
It was
early last year, right?
2005, yeah, it
Yeah.
was early in 2005, yeah. So I attended different functions, senior citizen events, protests, clubs and organizations, festival, and what I found that folks that I spoke with were anxious to sign, and the positive responses, I'd say, rallied around 90% of those who I asked signed the petitions.
That's incredible.
I know. It was really a much higher percentage than what I initially thought. I thought
I
I'd
I
have
was
to.
just gonna say because the national polling for Medicare for All, I think it's right around, like, 69 or 70%.
Yes, yes.
Why do you think the number of signatures you got was higher even than national polling?
I don't know. I don't know why that was. I was also surprised at the enthusiasm that people had to sign. They would say to me, "Give me that, give me that. I want to sign." And so there was that.
Except when we went to or when I saw you right outside of the town hall, of course, the one person that I saw that you reached out to didn't sign.
Right, right.
I had to give him a little hard time, you know?
Yes, absolutely.
The Delco Democratic committees,
Yes.
what was the reception within the party? Was there anyone helpful or were people just
Well,
not helpful?
I spoke to the following Democratic meetings: Lansdowne, Springfield, Upper Chichester, Mid-County, Aston, Clifton, Ridley, Upper Darby, Marple
Holy
Newtown, and
shit.
Haverford. And I was very pleased with the reception I received. They were all very welcoming. They all gave me time to speak. They passed around my petition. So that was quite positive. Only Swarthmore Dems turned down the request to speak.
Interesting.
Interesting, yes.
No comment?
No, not
Hmm.
really. And I'm still waiting to hear from my home district, Nether Providence. I've written them 3 times, but they have not responded. I don't know why.
Wow, that's unfortunate.
Yes, yes. Well, I plan to get on them a bit more because
Yeah.
I am in the district. I've been here since 1993, so, I think they should listen to what I have to say.
How about unions? Was there any sort of outreach with unions?
I did try to get in touch with unions. That was tougher. They did not respond back. I think that the reason is that unions are concerned about how Medicare for All would affect their negotiation policies because they always link in a healthcare benefit. And so I think they're kind of stuck on that. Also, many unions contribute to her campaign, and I'm speculating here that perhaps they feel that they have Representative Scanlon as an ally and don't want to lose that connection? I'm not sure, but I'm just guessing at that.
It's a good hunch. I mean, Mary Gay Scanlon does take money from corporate PACs, including I think it was right around like 90,000 from Ballard Spar.
Yes,
And and that
yes,
firm represents hospitals and health insurers.
yes.
Is it even really possible for a politician who takes that kind of money to advocate for Medicare for all?
Well, it's interesting when many voters are very surprised that Mary Gay Scanlon is not a co-sponsor, and I reply, check her donors.
I was
Who they
too. I was
the
surprised as well.
Yeah, and that's kind of an aha moment for people because people judge politicians on their public persona. If they stand with a group of scouts and policemen and firefighters and give speeches at rallies and advocate for quote good causes, it doesn't necessarily translate to passing legislation that really helps their constituents.
Yeah, totally. I mean, there's a direct correlation between taking money from private health insurance companies and corporate PACs and not supporting Medicare for all.
Yes,
I guess
exactly.
how do you make that donor accountability case to a Delco voter who doesn't really follow campaign finance? Because it's not that issue is not really front and center for most voters, which it should be.
It Right. I think so. I think again, her persona carries a certain appeal to voters without actually them knowing what's under what's underneath and supporting her. I think that if if people ask the question and I tell them that is the case, that's one way that educating folks on that issue. More broadly, I'd welcome any suggestions of how to put that out there. Now, there's a lot of energy nowadays. There's the Integrity Project, and many organizations are now trying to highlight this idea of what money politicians take. And so I think that is also another good thing, that I think people are becoming more aware of this. We just got to keep up the education on that subject.
Yeah, framing it locally is
Yes.
huge.
Yes.
And I'm sure you've obviously been paying attention with Crozier.
Yes.
Delco lost a ton of hospitals. People are living basically through the exact crisis that Medicare for All would address.
The interesting link is that Medicare for All offers a comprehensive solution by implementing a universal governmental system. Specifically, Medicare for All addresses hospital closures by establishing a guaranteed funding stream dedicated to services rather than the profit margins. And other developed countries have such a plan and are able to keep costs down and provide better health care outcomes for their citizens. And so it is embedded in the Medicare for All plan. And I've pointed this out to several organizations that that is the case. And advocacy for Medicare for All is another prong that they should be doing. In addition to needling the local organizations that are purchasing hospitals, I think they can negotiate with those folks. I'm not so sure. But
Have you been in contact with Jamie Blair or anyone at Put People First?
yes, I have been with.
I'm sure they're very receptive, of course.
Yes, yes.
So you're sitting on how many signatures at the moment?
Over 1,700 now.
Wow.
Yes.
And you haven't delivered them yet. When are you going to, or what is that going to look like?
Well, the end game plan still has to be determined. I want this to be successful. So I want everything in place to guarantee a successful outcome. And I realize that getting Mary Gay Scanlon to co-sponsor Medicare for All is just one step. We have to keep the pressure on locally and with our own groups to make sure that Medicare for All stays in the consciousness of our politicians and of the voters.
I mean, I don't know how it isn't, especially with the Crozier closures. Like it should be front and center.
Yes, absolutely should be front and center.
And you've heard from the webinar, you heard a ton of advice. People were saying either wait until after the midterms, deliver it in June,
Mhm.
go to the local media with it, or I think another one was even like find a primary challenger. So easy, right?
Yes.
What's actually on the table, and what of that advice are you going to take?
Well, what I want to do next is to form like a committee of voters and of organizations. I think we should come to some kind of place where we can all come together and make an advocacy. And I think that's the plan that we need to do. Yeah, is to decide when that will be, when we can get all these groups together, representative groups, voters that are interested, and put together a plan for how this should go forward.
Yeah, I know there was a few people that said what you're doing is impossible to do alone.
Yeah, right.
I guess, how are you using volunteers that might want to help you?
Well, I the groups have been enthusiastic, and they have certainly been supportive. I think what we need to do is coalesce that into with voters and coalesce that into one movement that can push this forward. I think that's what we have to do next.
What are some of the groups that you would want to band together to unite on this front? I
What
assume DSA Delco,
Right,
Put People First, Delco
right,
Indivisible. Are there any others?
right.
Any like church
Th-
groups or local
yes,
groups?
yes. I've been told that the Quakers are a very good group to work with, the Quaker folks. And so that's somebody I still have to get in touch with. DSA is very much interested. I met League of Women Voters at the Pride Parade. They were very much into
Yeah,
the
how is the League of Women Voters with that? Because I feel like they don't really take a stand on issues other than civic engagement.
right. Well, as I understand it, the way their platform works is that they can't advocate for a certain candidate, but they can advocate for certain policies. And actually, they have been long-standing on single payer.
Got
So
it.
so I've just recently touched base with them, but I think they're another organization that I think would fit into this, definitely.
So the meeting that you had with Mary Gay Scanlon last year, I'm sure she's getting wind of you collecting signatures somehow, some way.
I've
Has her office staffers or anyone like acknowledged your signatures or asked to meet or anything?
No.
Mm. Have you tried to?
No, we've told a lot of people have said they will contact her directly and ask her about this. Most people signed and then they say, "Oh, I live next door to her," or "I know who she is," or "I've worked with her before. I'll let her know,"
I live right next door to her. Please get
yeah.
into her ear.
Oh, there's a lot of people that live next door to her, evidently.
Yeah, wow. Huh.
Anyway,
She's got
so
a lot of next door neighbors, I guess.
yeah. So, so I think that with that, we should be able to move forward.
Before we wrap it up, if people do want to get involved and help you out, how can they actually help you? What can they do?
Well, they can, if they belong to a group, they can have their group get in contact with me if they believe in this. We have a I put up a little thing. We have a Facebook page. Is that backwards there? Facebook page, PA District 5 demands Medicare for all, and
Yeah,
so
I'll link that group in the description.
right, and then just my email, if they wanna contact me, kcalwick@gmail.com, that would be great. I'd be glad.
Are you open to having volunteers like actually collect signatures with you?
Sure. Yes.
Cool.
Yes,
Awesome.
absolutely.
Yeah, I'll put all that information in the description.
Okay, that'd be great.
Cool. Awesome. Well, we have been speaking with top universal healthcare activist in Delaware County, Kay
Yay!
Calwick. Thanks so much for joining me.
Thank you, Nick. It was a pleasure.